Hey, I appreciate everyone joining me. My name's Nathan Matlock. I'm the PGY2 Oncology Pharmacy Resident at Monument Health Cancer Care Institute. I want to do a quick clinical pearl on NCCN's oral antiemetic guidelines. Guidelines had a major update regarding how oral anti-cancer agents are stratified based on their emetogenic potential. The last revision not only categorized the agents different, but also offered no real protocol for antiemetic prophylaxis. However, we are in luck. Version 2.2022 from March of 2021 gives us some guidance we were waiting for. Prior to this revision, anti-cancer agents were classified into either high emetogenic risk, moderate emetogenic risk, or low emetogenic risk, or even minimal emetogenic risk. The prophylaxis for these agents were treated the same as how the parenteral agents in the same grouping would have been. So like I mentioned a few seconds ago, the previous revision of NCCN guidelines divided oral anti-cancer agents into 4 different groups, with those being high, greater than 90%, moderate, 30 to 90%, low, 10 to 30%, or minimum, less than 10% of emetogenic risk. Now we can see that NCCN guidelines separate oral anti-cancer agents into 2 different groupings. You have moderate to high, greater than or equal to 30% risk, and minimal to low, less than 30% emetogenic risk. Of course, these are just guidance, and each patient's antiemetic prophylaxis should be individualized as appropriate when a failure in prophylaxis should occur. When we are deciding on an antiemetic regimen for a patient, the agent or agents selected should be based on chemotherapy agent with the highest emetogenic risk, and of course patient-specific risk factors considered. In the high to moderate grouping, that is the greater than or equal to 30% emetogenic risk, NCCN suggests that patients should take a 5-HT3 antagonist prior to the anti-cancer agent, or our facility utilizes ondansetron 8 milligrams PO twice daily, whereas other facilities may opt for once daily dosing or the use of a different 5-HT3 antagonist. In the low to minimal grouping, so the less than 30%, NCCN suggests that patients should take a 5-HT3 antagonist prior to the anti-cancer agent. Again, our facility utilizes ondansetron PO daily as needed, whereas other facilities may opt for a 16 milligram dose of ondansetron daily as needed, or utilize an alternative 5-H3 antagonist. So like I said a little bit earlier, some patients receiving agents in the high to moderate grouping may experience a higher grade of emesis due to dosing schedule. Due to this variation, each prophylaxis regimen should be individualized. This was the largest update within this revision. Please see CCN for the full guideline recommendations for parenteral agent prophylaxis, breakthrough, anticipatory, among other, for suggestions. So that's all for this clinical pearl. If there are any questions, please reach out. My email is nmatlock@monument.health. Feel free to reach out at any point. I'll try to get those addressed and answered and get back to you. I appreciate it, and thank you.